role of EMS in your community. I'm Jill Horner. This is Comcast Newsmakers. With me is Christopher Reif. He is the operations chief of the Levittown-Fairless Hills Rescue Squad and president of the Bucks County EMS Chiefs Association. Thanks for being with us.
Thanks for having me.
When we talk about EMS in our community, you say the role of what emergency medical services does goes beyond simply transporting people to a hospital.
That's in a nutshell. We provide services just beyond transporting patients to the hospital. Often people think, call 911, the ambulance comes out, we take you to the hospital. In reality, we provide that service plus many other community-based services. Child seat safety services, 76% of children our car seats are installed incorrectly, so we partnered with Bucks Safe Kids to develop a program in Bucks County where not only can we put kids in child safety seats, but we have technicians available to make sure those seats are put in properly.
And that's just one example of what you do in terms of community outreach, but talk to us a little bit about the professionalization of what you do in terms of EMS. Some squads are volunteers, some are professional, but all undergo extensive training.
Very much so. We all work and operate under the same Department of Health protocols and regulations, and that includes from paramedic to EMT, 12-lead EKG interpretation by the paramedic, identification of stroke in the field, detailed assessments on trauma patients, and these requirements continue to grow as the profession develops. Right now, if you were to call 911 having chest pain in your living room, the paramedic and EMT will walk in and will perform a 12-lead EKG and would identify a heart attack right there in your living room, able to transmit that EKG to the hospital and speak to a physician to determine best medical care for you while en route to the hospital.
So before you even arrive at a hospital, that information is already being transmitted to those physicians?
Yes, and at the hospital end, they're preparing for the patient to come in, maybe to go to the cardiac cath lab or other medical treatments. And this is through the American Heart Association Mission Lifeline Initiative.
And that's just one of the things that you do, but let's talk a little bit about reimbursement, because that's been a concern whether you're a volunteer squad, a professional squad, in terms of insurance reimbursement for transportation to and from hospital. What does this mean for you as individual squads in Bucks County, and what kind of challenges does this present?
We all, volunteer-based, paid-based, a combination, we all struggle with the same failure of medical insurance reimbursement to the squads. We quite often residents would think that tax dollars go to support EMS in their community, and that's not entirely true. Some receive some tax funding, but not enough to make the ends meet, to be honest with you. So we rely, most of our budget is based off of medical insurance reimbursement, and the private insurers, they fail to reimburse us at the adequate rate. Thus, we barely meet budget, if at all.
And you say that's a major issue that you're dealing with, but going back to some of the things that you're continuing to work to do as squads throughout the area, you want to reach out to the community. We mentioned the idea of child safety and these checks with car seats, but you're also letting people know about new CPR. We remember taking CPR in school and having to use mouth to mouth, but things have changed.
Things have changed, and it's changed for the better. CPR now can be chest compressions only. We joke, staying alive from the Bee Gees, the beat, 100. Well, it works out that that's the beat we want to do chest compressions at, and that is we are finding tremendous success in saving lives. When if you collapse from sudden cardiac arrest, call 911 and start chest compressions. Don't do mouth to mouth, just do the chest compressions beat to beat to staying alive.
All right, some life-saving information.
Thanks.
Thanks to the Bee Gees. Right?
Thanks to the Bee Gees.
Thanks for being with us. We've been talking with Christopher Reif. I'm Jill Horner.